what do we do to start educating people about chiropractic? I'm just getting an education today, so
we got to get them in a chiropractor's office.
Okay.
And get them into an office where they wish to educate, which is our whole purpose. Because you're right, you can't, without knowledge, you can't do it.
Exactly.
Okay.
Got to be educated.
And even in our office, we have, become our office, we have our website full of education.
Okay.
My patients, if I can get away with it, I'll give them a whole bunch of stuff to look at. And many patients, to be honest with you, many do and many don't.
Okay.
There are many patients that feel that only the doctor needs to know. So as long as you know, doc, I'll be all right. And it's just really a lazy way out. Because the real truth is this: you can't do for yourself except what you understand to do for
And
yourself.
that's correct. That's
just
true.
like the few minutes that we've been together, there's been an increase in understanding.
Sure.
And there probably can be a whole bunch more increase. And as you get more understanding, then you're going to understand how to take care of yourself better. See, the real truth is, a person has to save their own life and promote their own life.
Sure.
It's not up to any doctor under the sun.
You better believe it.
And along with that, we have to understand how we live in the first place. And hopefully you're beginning to understand how your nerve system really causes you to live. The real you is your nerve system.
Right.
Because the truth is that exact difference between myself and a corpse is the real me and the real you.
Okay.
It's that spirit that animates my body. Okay? And that's what real chiropractic is about. In fact, chiropractic started in 1895. The first patient was a middle-aged man that was deaf for 17 years. Absolutely the truth.
Really?
Had one thing done to his spine and his hearing came back. So
Wow.
it was like turning it back on.
Unbelievable.
So that's the way it started. It didn't start with a neck pain or a back pain, even though that.
Interesting. And you're right, it's mostly associated with that. That's what
right.
people think.
Yeah. Sometimes we make a joke, who's that first person that turned it around from where it started?
Wow.
Because then no one knows the truth about how it all started. So even in our practice of 28 years, there's probably not a health challenge you can mention to me that I haven't seen go away.
Interesting.
With people understanding how their nerve system is paramount in their survival and their well-being.
Now, speaking of that survival and well-being, I know you have another great piece of equipment here called the DMX, or Digital Motion X-ray, that you've incorporated. Why is that so important, and how would it differ from a traditional X-ray?
The traditional X-ray is just like a snapshot camera picture. And so if you can remember ever getting a chest X-ray or any kind of X-ray, it's just a moment in time frozen, as you would have a still picture. And most problems with spines are in terms of function. That's why the Pro Adjuster is a real critical piece, because it really evaluates function. And joints are made to function. And if a joint doesn't function correctly in any part of your body, not only the spinal column, it's going to, that's what joints are made to do. They're made to function and move. And I put a cast on your wrist for a week and a half, and I took it off. Your wrist would be very stiff, sore, and weak. Just a week and a half.
Because it's not moving.
It's just not moving. So the joints in the spine behave the same way. Because joint physiology is joint physiology no matter where the joint is at.
Sure.
The big difference between the wrist and the spine is the fact that now when I have dysfunction in the joints of my spine, I'm going to involve my central nerve system, including my spinal cord. So that's where you definitely don't want to have joint dysfunction. It's there. So the digital motion X-ray is almost like a video camera X-ray.
Really?
So in other words, if I were to take you back there, I would just turn it on, be like turning on a video camera, like the camera that's taping us right now, and I could see inside of you, and I can see your spine do whatever I want it to do. So if I wanted you to dance, I can see your spine dancing. And what we do is we go through all the ranges of motion, and we determine specifically the exact condition of the spine. We determine specifically where it doesn't malfunction correctly. We determine many overlooked injuries within the spinal column, because the truth is, many times when people have problems with the joints of their bodies, when they're moving. Not that they don't have problems when they're not moving. But mostly it's when they're moving. So when I go to turn my neck to drive my car, I feel it's restricted. When I bend over to pick up my socks, I'm feeling restricted. Okay, so when you can study the spine or joints in full motion, then you can learn more about them and understand exactly what's wrong.
So is it snapping photos every second or every millisecond? Or
well, actually, the technology does about 30 pictures a second.
Wow.
So if you use it for a minute, you got about 1,800 pictures that you
That's
can
amazing.
produce. So it's every nanosecond, every split.
Wow, amazing.
Okay? And then when you start looking at spines and joints in that manner, then you can really fully understand what's going on. And I'm the only chiropractic office that has this digital motion X-ray. As I understand, there's 2 others in the state. They're not chiropractic offices.
Okay.
So as a result of having that, I am getting called on from other doctors.
Okay.
In particular, I had a chiropractor from Capex send me a couple of his patients this past week because they've been injured in major car crashes and no one seems to understand what's wrong with them. But as quick as I take a look at them, I can see what's going on.
Really? So it's much more accurate, obviously, than a traditional X-ray because you can't take as many photos.
Multitudes of times.
Okay.
Because typically when you look at a spine with still pictures, you'll take about 5 pictures, 4 pictures sometimes. As I mentioned here, you got 1,800 in a matter of a minute. But most importantly, you're viewing the spine in its full range of motion. Instead of just picking one little snapshot of slow motion. Okay? And most times, if it's true what I say, that we get in trouble when we're trying to cause motion in our bodies, so then we need to understand how to look at it in that framework.
Wow, well I tell you, you've got a lot going on here. We've got the Pro Adjuster here, we've got the DMX going here. What else is it that makes your office unique and special?
Basically what we do here in this office that really sets it apart is we practice chiropractic the way it was discovered and developed to be practiced.
Okay. Which is?
Very specific.
Okay. Highly
specific, and that's another point of why the DMX is critical for that, because it's very specific in its diagnosis, if you will. But very specific and with a true, full, and accurate understanding of how the spinal column and central nervous system really work in the real world. Now, most people don't get that type of service. They get what I would call a manipulative service that's more medical minded.
Right.
And a lot of times what's typical for patients is wherever they hurt, generally the doctor would feel that that's exactly what the problem is, and I just got to get in there. So if I have a hurt right here, then I'm going to do something here. If the hurt is here, I do something here. And that's really not the way the body works and how chiropractic works. Many times where people end up hurting is where they have compensated to something that went wrong somewhere else that may or may not hurt.
Okay, it makes perfect sense.
Okay,
sure.
And maybe a good analogy outside your body that could reference such a possibility. If the front end goes out of alignment in your car, you end up chewing up your tires.
Okay, perfect.
So the chewed up tire is one, that's the symptom or the disease, but then the cause is the mellow front alignment.
Okay, I got it.
So they're 2 separate things. So I cannot fix the problem with the tires by going to the tires, but I can by replacing them every time
you can put the Band-Aid on it that way, but the chiropractic is allowing you to actually go to the source of the problem.
That's right. Go to the underlying reason why the hurt is where it's at and why you're not healing it. See, the real truth of the matter is you and God heal you. There's no other way to heal. And if you're not getting it done, there's a hang-up in your system. Okay. And that's what real chiropractic is concerned about, where the hang-up is at.
Wow.
And how to get you back to being the healer that you were created to be.
Okay. Well, let me make sure I've got this right. Now, both machines are safe. Both are effective. They're also accurate and reliable.
Exactly.
So it sounds like we've got a win-win situation in both instances.
Across the board. And the right understanding.
And the right understanding. Okay. The knowledge.
And that's what I offer to do to people. We always encourage any person anywhere around here that has a health challenge that they can't get free from to come and talk to us here. Because most likely they don't understand how their body really works and how they have neglected their spinal column and central nervous system as the usual reason why they would end up having challenges and malfunction and bad experiences.
Wow. Well, I tell you, I've really been enlightened today. I'm so glad I was here to interview you.
Well, I'm glad you were too.
Again, Dr. Tocco, Clawson, Michigan. Now, the next time you need to be adjusted, check out Dr. Tocco in Clawson, Michigan. I'm Latanya Hall reporting.